All right, today we're going to demystify a condition that's super common, but, often kind of misunderstood. We're talking about chronic stable angina. We're going to look at what it is, exactly why it happens, and, most importantly, how we can manage it. So let's just dive right in.
So, to get started, let's meet this person, a 56-year-old woman. Her experience, this chest discomfort that only shows up when she's jogging and then goes away when she rests, that is the absolute classic signature of chronic stable angina. Her story is really going to be our map as we explore what's going on here.
So what is actually happening inside her chest when she's out for a run? Well, to really get it, we have to look at this fundamental mismatch that's happening right inside the heart muscle itself.
The whole problem really just boils down to a simple imbalance. You can picture it like a scale. On one side, you got your heart's oxygen supply, which is delivered through the coronary arteries. And on the other side, you've got the heart's oxygen demand. Now, when you exercise, that demand, it just shoots up. In a perfectly healthy heart, the supply just increases to meet it, no problem. But with angina, the supply can't keep up. The scale tips, and that imbalance, that oxygen debt, is what we call ischemia. And that's what causes the pain.
So what's causing that bottleneck in the supply line? Well, the main culprit is this process called atherosclerosis, and it doesn't happen overnight. It's a slow, step-by-step buildup. It all starts when the inner lining of the artery gets damaged. That opens the door for bad cholesterol to kind of sneak into the artery wall. Your immune cells then rush in to try and clean up the mess, but they end up getting waterlogged with cholesterol, turning into these things called foam cells. And over time, these foam cells pile up, forming a hard plaque that literally narrows the artery, leaving less room for blood to get through.
Okay, so for our patient, our jogger, and really for anyone with stable angina, doctors have a very clear mission. They approach treatment with two really distinct goals in mind.
Just two.
And this is absolutely key. Treatment isn't just about making the pain go away in the moment. That's goal number one for sure. Relieve the symptoms, let her get back to jogging. But goal number two is every bit as critical. You have to tackle the underlying disease to prevent something way more serious down the line, like a heart attack. It's a true two-pronged attack.
So, how do we actually achieve these goals? Well, physicians have this amazing pharmacological toolkit, a whole set of medications designed specifically to get that supply and demand scale back into balance. And these are the heavy hitters, the four main classes of drugs we use to manage the symptoms. Each one works in a slightly different way. Some focus on dialing down the heart's demand for oxygen, while others might help a little bit on the supply side.
Now, having all the right tools is one thing, but knowing exactly how and when to use them, that is the real art of medicine. So let's look at the actual game plan, starting with what you do right in the heat of the moment when an attack is happening.
Okay, for that moment of acute pain, like when our patient feels it on her jog, there is a very clear, life-saving protocol. First things first, stop what you're doing, sit down and rest. Then, you take a quick dose of sublingual nitroglycerin. That's a little tablet or a spray under the tongue. This stuff is a potent vasodilator, meaning it rapidly widens your blood vessels to get more blood flowing to the heart fast. But, and this is so important, if the pain isn't gone after 3 doses over 15 minutes, that's a medical emergency. You need help right away.
So, while those nitrates are the go-to for an acute attack, the day-to-day strategy is all about prevention. And the first line, go-to medication for that job is a class of drugs called beta blockers. You can think of these as the real workhorses of long-term angina management.
So how do they work? Well, in a nutshell, they just tell the heart to chill out. Seriously. They lower the heart rate, they reduce the force of each contraction, and they bring down blood pressure. By doing all of that, they massively decrease the heart's overall demand for oxygen. That makes it way less likely that a little bit of exertion is going to tip that scale and trigger an attack.
But there's a really interesting catch with another class of long-term meds, the long-acting nitrates. It's this thing called tolerance, and the way we discovered it is just a wild story. It wasn't in a hospital, but in explosives factories back in the 1800s. Workers handling nitroglycerin would get these splitting headaches at the start of the week, but by Friday, they'd feel fine. Their bodies adapted. Then they'd go home for the weekend, come back on Monday, and bam, the headaches were back with a vengeance.
So this bizarre Monday morning headache thing actually taught us something absolutely crucial. For long-acting nitrates to keep working, your body needs a break from them. And that's why today, patients are prescribed a daily nitrate-free window, usually about 8 to 14 hours overnight, to basically reset the system so the drug works again the next day. Okay, so we've talked a lot about managing the symptoms, about making our jogger feel better. But what about that all-important second goal? How do we stop the underlying atherosclerosis from getting even worse and causing a major crisis?
Well, to do that, we bring in two other cornerstone therapies. First, an antiplatelet drug like low-dose aspirin. This makes your blood less sticky, so it's harder for a dangerous clot to form on one of those plaques. And second, a high-intensity statin. This is recommended for pretty much everyone with stable angina. Statins are fantastic at lowering bad cholesterol, but more importantly, they help stabilize the plaques that are already there, making them less likely to break open and cause a heart attack.
And that brings us right back to our 56-year-old jogger. For her and for anyone managing a chronic condition, the goal isn't just about feeling better on the next run. It's also about preventing a future crisis that she can't even see coming. And that really leaves us with a question to think about. Is feeling better enough? Or is the real victory in preventing the silent progression of what she can't even feel?